When you sleep, are you a mouth breather or a nose breather? Is there a difference? Of course. If you wake up often in the middle of the night, or you feel really tired during the day, no matter how much you slept the night before, there's a chance that you may breathe through your mouth more than breathing through your nose when you sleep. So there are a lot of problems with mouth breathing. It's not only loud, it can give you dry mouth, headache, poor sleep quality, and eventually you will not feel well rested or refreshed in the morning. So in this video, I don't want to focus on how bad the mouth breathing is. Instead, I want to really encourage you to think about how to get that great nose breathing when you sleep. That way, you can sleep well and rest well. So here are 4 strategies you can try. First, try to get your tongue in the right position. Gently rest your tongue in the roof of your mouth. So your tongue is supposed to rest there gently like that all day long, except when you are eating or drinking or talking. When you're asleep, your tongue's supposed to be there too. And if you do that, you can only breathe through your nose, not your mouth. So you can try to practice that when you are awake. Really practice the muscle around it. If you have trouble with it, you can go to a myofunctional therapist. They can train you to see whether through this kind of muscle training can really help improve your nose breathing. 2, try positional therapy. So when you sleep, you can try to use a pillow or those kind of smart bed to lift your head up a little bit. Or you can try to sleep on your side as much as possible. All this can help you really open up your airway so you can breathe better, and that can promote the chance for us to use nose breathing at night. 3, avoid drinking too much alcohol close to the bedtime. You know, alcohol can really relax your tongue, your oral muscle too much. So it actually could increase the chance for you to breathe through your mouth or even snore. 4, try mouth taping. So I interviewed an ENT surgeon, Dr. Park. He actually recommends many of his clients to try mouth taping, but in a very specific way. Also, he asked people to check out this one thing first before you dive into trying this mouth taping method. What is it? Let's find out.
I actually encourage mouth taping, but before you try mouth taping, make sure you breathe well through your nose. So you have to do everything possible. For example, just using breathe right strips or nasal saline. What I actually offer as an experiment for my patients is before we start chronic medical treatments like allergy sprays or shots, use Afrin, which is a decongestant spray. So this is that spray that you can't use for more than a couple of days because you get addicted to it because it works so well. Use Afrin for 3 nights along with breathe right strips. So that will address the nostrils and shrink the turbinate tremendously. So it's like a temporary surgery. And so if you can breathe well through that, then tape the mouth. And normally I like to tape vertically with that 1-inch white tape you get from the pharmacy. I don't like going this way. Well, you can do it this way, but the problem is that if you tape your lips together, you can still open your jaws a lot. That's what's causing the obstruction behind the tongue. It's not the tongue tip, but the back of the tongue. It moves back a lot when you open your jaws even a little bit. And so what I do is I tape vertically to go under the chin to kind of suspend a little bit more. So it's not perfect, but it's much better than just doing this. And if you have to breathe, you can breathe through the corners of your mouth. And worst case scenario, if it's uncomfortable, just take it off. You'll wake up anyway because, well, if you don't use it, you'll wake up anyway because you stop breathing. Right? So, and if you use it, there's less of a chance you'll stop breathing because you keep your mouth closed. But the tape issue, it does help. Some people, it's dramatic. But like any other treatment, there's this gradation where it helps a certain number of people, maybe 10, 20, 30% amazingly well. The middle third, maybe somewhat in the last third, it doesn't help at all. It makes things worse. So I don't think there's any harm in trying. But again, I have to emphasize, you have to make sure you're breathing well through your nose first.
So, at the end, I want to ask you, what have you tried to be a nose breather? Leave me a message down below, let me know. Thank you for your interest in sleep science. Please remember, sleep is a very individualized thing. Please respect what your body really needs and allow sleep come to you naturally. I'm Dr. Yishan. Thank you for watching. I will see you next time. Bye. Are you struggling with insomnia? Do you know there's one method out there? It's first-line treatment in many countries. It's very evidence-based and it's very effective. And it's called CBTI. So I have designed this 4-week-long CBTI course to help you recover from insomnia without relying on medication. I provide weekly Q&A sessions to help you tailor the treatment to your own needs and your own sleep pattern. Check it out at this website, mindbodygarden.com/insomnia.